Dr. Suwit, I have the privilege of requesting you for your remarks.
Thank you so much. After listening to Dr. Yongyut, before I start my presentation, I would request all of us to close your eye and take deep breath for 3 times. Okay, are you ready? 1. 2. 3. Now you're ready to concentrate on my presentation, right? And apart from that, he also talked about physical activity. I request you to stand, and sit, and stand, and sit. Last one. Stand and sit. Thank you. I'm going to move forward on the government procurement in a practical way. I have to do physical activity, right? Rather than sit down. Bring the theory, the concept into real practice. What do we do in Thailand? We have our universal health coverage. Thailand is one of the not so many developing countries with universal health coverage. Thank you. 100% population coverage. The budget is very big. Total 3 funds, total together, more than the 12 billion US dollar. But the biggest fund is about 8 billion US dollar. This is a big, big fund. Big purchasing power. And the government has the policy that what we call innovation list. If anything qualified to be put on the innovation list, the government requests public procurement to procure at least 30%. What happened after several years? A research found that less than 1% were procured. So the board of the universal health coverage said that, no, we will not let that going on. For us, we will purchase 100%. But most of the products are purchased by the provider. So they start so-called central procurement, and they procure 100%. I don't go with this here. Government procurement over there. Government procurement over there, right? And we have the cooperation of 3 national agencies. Thai FDA at the top has to approve the product. These are medical products, standard, quality, efficacy. The NSTDA has to approve it on the innovation list. And NHSO, National Health Security, has to approve that this is part of the benefit package. And we are the one who are going to pay to buy 100%. Okay? So there's an organization called TCell, Thailand Center of Excellence for Life Science. They provide funding support for the SME, for all these 3 to work together to achieve this. It's a tough job, not easy. So these are the 8 products that we have already put onto the market with this system. 100% procurement. 8 products. From dental implant, dental root. Our universal health coverage cover dental root as well, but only for those who lost all their teeth and they cannot fix their plastic denture well. So we put 2 root on that. The price in Thailand, innovation product, is 3,000 baht. The lowest imported product was 700 plus, 7,000 plus. So we are much cheaper, right? When we roll out, we do it central procurement, and we distribute to dentists to use. Once we roll out this, the imported company reduced their price to 1,800 baht, 60% of our price, 4 times less than their original price. And they convinced the dentist that, hey, the dentist, don't accept those products, 3,000 baht. You go to tell them, give you 3,000 and you buy from us. What would happen? The 3,000 Thai product die. And soon 1,800 become 7,000 again. And if you want to buy 3,000, no more. Already die. See, that's how they kill us. Dumping, we call dumping. Okay? Colostomy bag for those who have colon cancer and cut off their colon, and they have to, instead of defecate, normally the feces come out of the abdomen, and there's a bag. Imported product, 240 per bag. Our product came out, 150. So we purchased 100% there. Huge difficulties. First, the professionals, the nurse, the doctor, they are used to imported product. They work very closely with the company. The company invite them to dinner. The company invite them to travel abroad, enjoy themselves. And some other fringe benefit, I don't know. So they said, our product is not good. When you stick it, it drop. You stick it, it drop. They even take video clip to see clearly that our product is bad. It's not sticky. I was so surprised, how can this product pass through the approval of FDA and STDA to be on the innovation list? So I asked them, give me 4 bags. I put it here, on my own self. 4 bags, not just one. Upper, lower abdomen, right, left. And I put the toy clay of my grandson, like the feces, put in the bag. And I put the water, in case you have diarrhea, right? It may leak. And I steal some of the perfume from my wife to see whether it protects the smell or not. I stay with that for 12 days and night. Behave like a patient. No problem at all. This is what we are facing from health professional. And the embassy of that product called the director of the National Health Security Office who purchased this to her residence, have dinner and talk 3-4 times. Even invite him to the country. But he paid by himself. He asked me, he said, you go, learn, but paid by yourself. Now they reduced to 120 baht. 120 baht. Our price still 150. And they push every hospital to put pressure on us to give the hospital 150 baht, so that the hospital can buy that 120 by themselves, instead of buying 240 earlier. So it's not easy, government procurement. You have to be very determined to do that. We have many things more. Even the drug, acerola pertussis vaccine. The latest one, the Inspecta chest X-ray, AI chest X-ray. We already fixed it in almost 200 hospitals now, paid by the universal health coverage. Next year, it will become 800 hospitals. So these are the number of patients, the amount we have sold is still very low. It's not that high money, not that big money. It's about market price is about 700 million baht, which is maybe 25 million US dollar. It's still very small, but we aim high for the future. So this is a story of how to use government procurement for medical innovation and what kind of obstacle that you will face from the users, from the competitor. Previously, they control all the market. Now you want to kick them out, to replace with someone, they fight you to death, for sure. Some of our products even export, but still very, you see the fourth column, export market is still very low. Only the three-dimension 3D printing, titanium skull plate, very small, but it's moving. All this happened only 2-3 years. So we hope that by 10 years, it will fly. Thank you.